Okay, before we jump into the course, there's some stuff we need to make sure that we're paying attention to. First and foremost, this course is designed to relieve tight and achy joints and ones that have normal run-of-the-mill arthritis, the type of degeneration we get purely from aging. This course is not designed to help with injuries. So if you have a new pain, even if you don't know what it came from, or you specifically have an injury, this course is not designed for you. Those are the kind of things you need to make sure that you seek medical care for before going into this kind of course. It might be that you're having a flare-up of an old pain or something you're familiar with. That's entirely fine. But if you're experiencing a pain or a tightness that you've never had before, especially if it's come on suddenly, it's really important that you seek medical care before doing this kind of course. Next, if you've had injuries in an area, you need to make sure that you're careful in that area. It doesn't mean that you can't do it, but only you and your medical provider are going to know the specifics of those injuries. So for instance, I'm going to be doing a lot of these exercises with you. I have broken a few things in my wrists and a few things in my hands. They've all healed well enough that I'm not worried about introducing any kind of new injuries or problems into the area with any of the exercises we're going to do. But if you've had injuries that you have had surgery on or have had implants that were metal or pins, or there's things you're just not sure whether or not you should be doing, just make sure that you seek medical care before you start this course and make sure that injury is healed. So if this just happened in the last 2 months, you probably don't want to be starting this yet. But if it happened 2 years ago or longer, you can definitely jump into this sort of thing, assuming that there's nothing odd in the way and you've got the clearance of a medical provider to use your limbs as you need to. Next thing is surgeries. So a lot of us have had small surgeries, and if we're talking about something like removing a skin tag or a mole or something of that sort, it's really not that relevant to what we're going to do. You can definitely proceed with this sort of thing as long as it's all fully healed. But if you've had surgeries for things like carpal tunnel or you've had pins or plates put in, it's really important that you understand the nuances of what we're going to do and that you go very slow. And I'd strongly prefer you get medical clearance before you jump into this, because every surgery can be different and every need for surgery can be different. So if you're looking at surgery or you've had it before, please proceed very carefully, and I'd strongly prefer you get the care of a medical provider just to make sure we can do this sort of thing. One other consideration, but definitely not a reason to stop, is osteoporosis. So most of the time, osteoporosis is only going to affect us if we're doing things that have a huge amount of impact to them, or we're using a lot of weight, or we're putting force into the body. Almost everything that we're going to do is going to be very, very low force. This is meant to be introductory level to make sure we can use our hands and our wrists in every way that we know how. This is not going to give us a lot of resistance and hence not a lot of force. But if you have really advanced stage osteoporosis and osteopenia, then it wouldn't hurt for you to get the approval of a medical provider if it's the kind of thing that we're worried about fracturing bones if they're that advanced. Most people, even if you have it, you should be fine. But if you've had any fractured bones previously due to these things, or your doctor has warned you about exercises, please make sure you're getting approval before you continue. So there are other kinds of arthritis as well that we also need to be very careful of. And these are more than the degeneration or osteoarthritis. So osteoarthritis, which we shorten to OA, is the kind of standard kind of arthritis that a lot of people get as they age. It doesn't even necessarily have to hurt. For some people it just causes stiffness, some people feel nothing at all, other people it causes some pain. But there are other kinds of arthritis we need to pay attention to. These are things like rheumatoid arthritis or psoriatic arthritis or autoimmune arthritis, and there's a lot of different varieties of these. And the reason is because these are not just wear and tear. These are not just the kinds of arthritis that come on over time. These are the kinds of arthritis that have some kind of immune aspect to them or a strong inflammation aspect to them. So if you have one of those, especially something that you're on medication to control, it's very important that you pay close attention to the exercises we're doing and stay well within your limits. With certain kinds of arthritis, it's okay to really stretch and push and try to get better. But with ones such as rheumatoid arthritis or psoriatic arthritis or other kind of advanced or immune-based ones, it's really important that you stay well within your threshold just to make sure that we don't irritate anything and we don't cause any kind of inflammation or damage. Similarly, people that have kind of our normal arthritis, the osteoarthritis, if it's really advanced, you're going to treat it very similar to the different kinds of arthritis. And by that I mean if you have really large swollen knuckles and they're extremely stiff and they're extremely painful and you're getting out there in age and you're getting into your 80s and 90s and you're having a hard time, that's no reason not to do this. It's awesome that you're here. I'm really excited that you're doing it. You just need to be a little bit more careful, because as we get into the later stages of arthritis, our bones physically start to change. And so for the most part, we should be entirely fine. It just means that if we're doing stretches, that you limit the range of motion and make sure you don't push into pain. If we're doing exercises, that you just don't go as aggressive as you can. So if you're at the later stages and pretty advanced osteoarthritis, it's entirely fine for you to do this course. I would be doing this course if that were me. I just need you to make sure you're going carefully and going slowly into all the movements that we're doing. So the last thing I specifically want to talk about is if you don't have feeling in the area. So this doesn't happen very often, but it can happen with people who have experienced certain kinds of radiation, or people who have had certain kinds of nerve injuries, or people who have advanced stage diabetes. There are a lot of different things that can actually change our ability to feel in the area. So if you don't have feeling in an area, whether it's globally through your entire hand, just a few fingers, or just a certain part of your wrist, it's really important that you go slow, because we need feeling in that area to judge just how hard and what we can be doing in the area. So if you've had a nerve injury, or you've had advanced stage diabetes, or you've had radiation or chemo or anything that's affected your ability to feel your extremities, it's really important that you go slow. I'm not going to say you shouldn't do it. You just need to make sure that you understand where your limits are and you pay attention to your body very closely as we go. If you have any other concerns or questions about whether or not you should be doing these exercises, please seek the advice of a qualified medical provider just to make sure that you can be doing introductory level exercises with your hands and your wrists. That's it. Let's jump in.